Hey, we're back with another episode of 10 Patients in 10 Minutes. And this one, episode 1, pelvic floor pain, and also a case of pudendal pain. Those can be used interchangeably, and sometimes they cannot. We're going to specifically call out one case in this series that was, in fact, a pudendal nerve pain, and we know that for sure. So we are going to look at these 3 cases. Start with the youngest gentleman. All these will be males. Pelvic floor pain, I don't remember what specific side, but it also included some genital urinary symptoms, such as problems with an erection. I'm going to go ahead and draw in some of the changes so you can see the shift that's here in the body. This is the lower pelvic area. This is splitting the middle of the pelvis. And you can see how in the image on the left, the upper body mass leans over towards the right. We've got less lean of the upper body mass in the post-correction image. Less lean of the head and the neck back to the left than we do here, and it's kind of hard to visualize because of the plane that we're looking at it, but if you look kind of at the shoulder, you're going to see that this image has a little bit more forward rotation here. So this is how he unwinds after his first correction. He comes for a couple visits and has about 50% reduction in the pelvic floor pain. This is the second case, a male, quite a bit older. He has overlaying symptoms, and this is often what we see with the pelvic floor pain involving the bladder and the pelvic floor. As it turns out, the bladder issues would need to be resolved surgically, but the pelvic floor problem would still remain. They thought that perhaps that pelvic floor would calm down after the bladder surgery, but it did not. So what we're going to do here is we're going to point out the shift that was possible in his pelvis. So you're going to see this here. That here, that's the center of the pelvis. You can see kind of the elevation on this right hip, and just kind of how that hip and pelvis is rotated. You can see the way that his body mass goes away from the high hip, over towards the left side, and the way that his head and his neck counterbalance back towards the right. The post-correction image clearly shows that he's more on the vertical axis. He's standing taller. There's less hip issues. The pelvic floor problem would resolve both by unlocking the neck in the protocol that I use to do that, as well as specifically adjusting and releasing L3. The L3 vertebrae in this case was very much rotated, and that needed to be unlocked in order for complete resolution of the pelvic floor pain. Moving on to the third and final case, which has been featured in other articles on my website because it's a very satisfying case in the sense that the patient's symptoms were around for quite some time, and this was a true pudendal neuralgia in the sense that the symptoms went from the base or the pelvic floor all the way out via the genitals, and it had some associated symptoms with that. I won't get into too many details on that, but here you see the shift in the upright body structure and the pelvis after the first release. Specifically, in this case, just cervical spine only. Again, center of the pelvic mass. Again, you see a lean away of the body from the side of the high hip. The high hip was actually over here. That's not well indicated by this line. There's forward rotation of the body towards this side. You can kind of visualize that. That rotation comes out, and you can see how both the head and the neck come back to vertical after that release. And I was quite happy with how this gentleman shifted, and there is, over some time, took a little while, in general, a complete resolution of the pudendal nerve pain, and then the symptoms associated with the pelvic floor, which could also include some posterior hip pain. They are mostly gone. On occasion there is a flare-up. Okay, so that was the final installment of 10 Patients in 10 Minutes. Dr. Zachary Ward here at Life Alignment Chiropractic. If you have any questions about anything in this video or any of the other videos, clearly we've gone over 1 minute for this video, but you can look up more at laachiro.com. You can call me at my office line, 248-598-4002. Also on Facebook at /LAA Chiropractic. Hope you found this informative, especially if you do deal with pelvic floor pain. Have a great evening.